Hello, I'm Dr. Sarah Rollins. I'm a consultant in sports and exercise medicine, and I work for Pure Sports Medicine. In particular, I work at the Raynes Park branch, which is near Wimbledon. I'm an ex-army GP. That's where I did all my training. So straight out of university, went straight to work in the army. And I moved across to sports medicine in 2012 when I started working at the Regional Rehab Unit in Aldershot. So I've done 12 years of working with the military in rehabilitation of sports injuries, training injuries, and trauma injuries. So I now work in two roles. I work for Pure Sports Medicine, and I still maintain my role in the military at the Regional Rehab Unit in Aldershot. I do very much the same thing in both roles, looking after people who are injured through sports or trauma, however they've managed to sustain their injuries. My particular interests in sport and exercise medicine range from pretty much anything that can be seen on an ultrasound scan, and I'm particularly interested in exertional lower and upper limb pain, so even looking at vessels that are affected during activity. I also particularly specialise in looking at the anterior abdominal wall, because I do a lot of work with women who have problems with a wide diastasis after having children. So, and that leads on to one of my other main areas, which is that I specialise in women's health rehab, and I'm particularly passionate about working with women with joint problems related to the menopause. The reason I work at Pure Sports Medicine is because I work in a team of fantastic consultants and physiotherapists and other allied health professionals. We actually work as a multidisciplinary team, so if you see one person, you're actually getting the benefit of more members. There's a whole line of people stacked up behind that person. We talk about difficult cases, we share ideas, and Pure Sports Medicine does that really well. So one of the things I've talked about is that I specialise in using ultrasound in my diagnoses. That means that if I'm seeing someone with an ankle injury, a shoulder injury, a wrist injury, whatever that injury might be, once I've done the assessment, I can then immediately use the ultrasound machine to scan that body part, which then assists in diagnoses. And sometimes you can make the diagnosis straight away. There are limitations to ultrasound, so if we can't see what the problem is immediately, or if it hints at a problem but we recognise that it's not best seen on ultrasound, then I can of course refer on for MRI scans. Also using the ultrasound, of course, is I then, once we've made the diagnosis, that could include, the treatment could include injection therapy, and then I can do that using ultrasound as guidance. So really a fantastic thing that we have on offer at Pure Sports Medicine. So outside of work, I'm a very passionate runner and orienteer. I run for Aldershot and Farnham District Running Club and train with a masters group of women. And I have previously run for Great Britain in orienteering. I went to 13 World Champs, and I still go to the World Masters, and I got a gold medal last year. So I'm still having to train very hard to keep my body in shape to do that. So I understand a lot about training for masters athletes. And so I very much like looking after that age group as well.